Hi friends! Do you know millions of people around the world have autism? Do you have any idea of where does India stand? As per the 2024 data by Indian Autism Center, there is a shocking rise in autism rates in India. Autism Spectrum Disorder, ASD, prevalence has grown from around 1 in 68 in the year 2021 to 1 in 36 children in 2024. While figures suggest an increasing trend, many cases remain undiagnosed due to a lack of widespread screening and resources. Boys are more commonly affected than girls, with a male-to-female ratio of approximately 3:1. Now, hearing numbers is one thing, but imagine sitting in a classroom of 36 children. Statistically, one of them is likely autistic. Surprising, right? Early intervention is crucial, particularly if a child does not speak by age 2 or reacts more to objects than facial expressions. Pause for a second and think. Do you know a child like that? It doesn't always mean autism, but it's worth paying attention. This urgency was emphasized at a workshop hosted by the Indian Association of Pediatrics and ICON Foundation, where pediatric neurologists from prominent institutions, including AIIMS Delhi and Sir Ganga Ram Hospital, gathered to share insights. This shows that awareness is growing at the highest levels. But how about at the family level? That's where you and I come in. There is an importance of timely neurodevelopmental therapy. Nearly 50% of children with speech delays exhibit autism symptoms. Parents should have a careful observation of infants, suggesting that a preference for objects over facial expressions could indicate a need for further assessment. Moreover, families with one autistic child face a 10 to 15% risk of having another affected child, making genetic testing important for early diagnosis and intervention. Although autism is very common, many people do not know much about it. Now let's clear up some of the most common myths that cause confusion. And as you're listening, think, have you heard any of these before? Myths regarding cause of autism. At this time, scientists do not know exactly what causes autism. Many people make assumptions about the cause, but these assumptions can become myths. Here are some of the most common ones. Vaccines cause autism. Have you ever heard this? If yes, you're not alone. Many still believe it. Bad parenting causes autism. This one is especially hurtful to families. Imagine how guilty parents must feel hearing this. Something a mother did during pregnancy or while raising her child caused autism. It is important to note that there is a lot of research going on to understand what causes autism. But what causes autism remains an area with many unanswered questions. If you or someone you love is autistic, hearing these myths can be painful. So here's what we know for sure. We don't know what causes autism, but we do know that it is partly genetic. As per the most recent research published in the Brain Research Bulletin in July 2025, ASD is believed to arise from a combination of genetic and environmental influences. Autistic people are born with autism, and it affects how our brains develop. No two autistic people are alike, but differences in communication, sensory processing, desire for routines, and other characteristics are commonly shared by many autistic people. There are also many myths about who can be autistic. Some myths are, only children have autism, autism only occurs in Western countries, autism can only be diagnosed in childhood, autism is just a trendy label and people are being overdiagnosed. Here is the truth about who can be autistic. Anyone can be autistic regardless of gender, race, nationality, or financial status. Think about that. It could be your neighbor, colleague, or even a celebrity you admire. Autism does not discriminate, and it is lifelong. Although many people are diagnosed as children who grow up to be autistic adults. But you can get a diagnosis of autism at any age. But it is best to get it early because a diagnosis can help schools, workplaces, your community, and your family better understand how to support your needs. If you are still watching, I'd like to appreciate you for taking out time to understand such an important topic. Comment, I'm learning if you've stayed with me so far. I'd love to know who's really engaged. Stick around till the end for a complete understanding. Let's start. Myths regarding what autism looks like. Let me ask you, if you picture an autistic person, what image comes to your mind? Chances are, it's based on stereotypes from movies or media, but reality is much broader. Autistic people are all different. Each of them have our own strengths and challenges, but many people don't understand what autistic people are really like. And that leads to myths such as autism looks the same in everyone who has it, or all autistic people have intellectual disabilities, learning difficulties, or special talents. Myths like autistic people cannot form relationships, feel love, or have empathy. There are also myths such as all autistic people are interested in math, science, or technology, or they do not like to socialize or connect with others. Myths like autistic people are violent or dangerous. But let me clarify that none of these myths are true. Here is the truth. Autistic people are very different from one another. Autism is a spectrum, which means it affects people in many different ways. Some autistic people speak easily, while others may not speak at all. Some have other disabilities, but others do not. Autistic people have all kinds of interests just like anyone else. They may not show their feelings in the same way, but that doesn't mean they don't feel deeply or want to connect with others. They too can feel lonely, love others, and want to socialize. Myths relating autistic people with violence. Although some people with autism may engage in behaviors that are harmful to themselves or others, but this is rare and usually occurs when they feel overwhelmed or out of control, it is a sign of distress, not malice. There is no evidence that autistic people are more violent than anyone else. In fact, research shows that autistic individuals are far more likely to be victimized, bullied, and abused than to engage in criminal behavior themselves. This is something we don't talk about enough. And it flips the narrative completely, doesn't it? If this video cleared even one myth for you, share it with someone else. Let's make sure misinformation doesn't spread faster than the truth. The best way to understand autistic people is to get to know them and respect them for who they are. These myths are harmful and can make life more difficult for autistic people. As parents, family members, and friends, we need to support autistic people and make sure they feel loved and accepted. Autism does not change, but people can grow, learn new skills, and get better support over time. With the right help, autistic people can lead fulfilling lives that are meaningful to them. Here are some things we can do to better understand autism and combat these myths. Get information from reliable sources. Many people who spread information about autism have something to gain by selling products or ideas. So be careful about your sources. If you have an autistic child, nephew, or anyone you care about, connect with other parents of autistic children to build a community and learn from each other. Most importantly, listen to and learn from autistic adults. They can help you understand your child and support them in the best way possible. Thank you for listening. If you have any questions about autism, feel free to comment down below. If you like this video, I request you to like, share, and subscribe for more health info. Until then, take care and stay healthy.